So Medorinum, it is the king of antipsychotics among the nosots. So as like Tuja is the king of antipsychotic among other remedies, this one Medorinum will be the king of antipsychotics among the nosots. So it is the nosot of gonorrhea, attenuations of the virus being done, the Neisseria gonorrhea, or from the discharge that is being taken. And Medorinum, I don't know, probably sir might have taught you this very finely. Uh, this one, if you go to take this book, Allen's Keynote, even in Allen's Keynote, this is a complicated drug. Even in Allen's Keynote, it spanned for 3 or 4 or I think 5 pages. And personally, if you ask me, whenever I was studying Medorinum, I had to study this drug in first BHMS, and then all the drugs will be asked until final year, even for MD. So we can't just say that first year drugs won't be asked for second year, nothing like that. Second year, third year, every year they might be asking. So all the drugs we have to study every year. So every time Adorina when it comes, because it is 4 5 pages, I will be thinking like, okay, I will study it later, I will study it later. And even up to now, so many exams I have wrote. Even up to now, I don't know the exact what is being told in Madhurina because I always skip towards the end. I wouldn't find any time to study this, but I always skip it. But that much complicated symptoms are not complicated, much vast. So in your case, I shortened it only those 1 or 2 symptoms that is very important in our exam basis also and also a clinical point also. The basic thing is because we are saying about the gonorrhea and its after effects and its psychotic miasm, the person will be always having that psychotic miasm constitution, or like he will be having a cacotic constitution. The towards the end of the psychotic, it is always the growth that is indicating. So anything, whether like a cancer or something, mostly it will be some organic lesions, especially cancer. And towards the end, the person will be having that typical cancer cacotic symptoms. That will be his constitution, and then there will be a burning pain. That one of the other red line symptom will be that there will be burning pain all throughout this body. Then aggravations, it can be like the too much hot because it is hot body, so already hot or burning sensation is the. So generally aggravation from warmth and amelioration from cold. Uh, this is mainly their symptoms, and then yeah, rheumatic symptoms. The rheumatic symptoms is also very important because it is a psychotic one. So psychotic medicines, they have a pathology in rheumatism. So the rheumatic symptoms are characteristic, and we will see that symptoms are somewhat or very much similar to that of Restox. And also the clinical features will be very similar to that of rheumatoid arthritis. Because arthritis is a sequel of suppressed gonorrhea. If you remember the gonorrhea that you have learned in the secondary or the tertiary stages, when the gonorrhea has gone aggressive or suppressed, it can result in arthritis. So that symptoms will be there. And another important feature or the sphere of action for medorinum will be in female reproductive system because it is gonorrhea. The female reproductive system, be that ophritis or metritis, uterine inflammation, um, then what is that? Inflammation of fallopian tube, whatever, and that resulting in perhaps infertility or some complication with excessive menstruation or even cancer of these female reproductive structures. Medorinum is a good remedy to think about. And lastly, in respiratory organs, asthma is a very good, Medorinum can be given for asthma, and there is a particular position the patient will be taking in during asthma. So that is in short Medorinum is about when we are coming towards the exam point of view. So in case of Medorinum, It is used for the constitutional effects of maltreated and suppressed gonorrhea, when the best selected remedy fails to relieve or permanently improve. And that sentence you can see all the king of whatever. We take sodinum, we take sulfur, we take syphilinum, merxol, medorinum, tuja. We can find this sentence. Whatever, like which miasm they are concentrating, that will be what the first sentence will be. And then when the best selected remedy fails to improve, because it shows that underlying miasma is there. So the persons will be usually suffering from gout, rheumatism, neuralgia, and diseases of the spinal cord and its membrane. Every organic lesions will be there, because there will be organic affections, and this can be ending in paralysis. And when we trace back, we can may get a history of psychotic miasm, like a cancer or a gonorrhea or something of that sort we will be getting. And in case of women, as I told, all the itis in the female reproductive organs, ovaritis, salpingitis. Yeah, salpingitis is inflammation of the fallopian tube. Then pelvic cellulitis, fibroid, cyst, any other morbid growth of uterus and ovaries, especially cancer, if symptoms point to malignancy with or without psychotic origin. Therefore, the cancer which are very hard in nature, the serous cancer, either acute or chronic in development, when the symptoms correspond with a history of psychosis. Everything like is related to cancer, psychotic, or its after effects, or the sequel, which is the gout, rheumatism, neuralgia, etc. Bears the same relation to deep-seated psychotic chronic affection of spinal and sympathetic nervous system that sorinum does to deep-seated affections of skin and mucous membrane. I guess you understand that. It is similar, like sorinum among the nosodes, it is the king of antipsorics. And this one among the nosodes is the king of the antipsychotics. So when sorinum is having the action on skin and mucous membrane, similar action will be possessed by medorinum in nerves, spinal cord, and also the sympathetic nervous system. So everything that is related to, even when we now go to the symptoms, we can see that their headache, a headache will be seen in the base of the brain, and from the base of the brain, it will be moving towards the spine. Even in the back ache, when we see that there will be pain in between the scapula, the back backbone will be so sensitive, the vertebra will be so sensitive. So the chronic, the spinal cord affections can be seen, and also sympathetic nerve system, and that is why we are having this complaint of neuralgia also. And the patient we see later, they will be saying about burning, especially in feet, and also palm region or the hand region, and that burning also appear, which is due to a nervous complaint. In children, if it is affected, usually it is because the inborn affections or congenital thing, when their parents were infected and they were born with it. So they will be having some growth issues. They will be having pale, rachitic or rickety symptoms, dwarf and stunted in growth, similar to Barita cup. Mentally, they will be very dull and very weak, because their growth and development is affected. So definitely not just the physical growth, but even the mentally they will be like a dull, cretin person with great heat. But more important will be the enlargement of lymphatic glands all over the body. So all the diseases in which there is lymphadenopathy, we can think about it, and not just some acute or subacute diseases where there is lymphadenopathy, but those diseases, because we are saying about children, and children, they also can develop cancerous condition, and in them, when there is a lymphatic gland enlargement, when we connect it with our practice of medicine or medicine thing, we know lymphadenopathy is very common when it is the cancer, the lymphoma, Hodgkin's lymphoma, or even the leukemia. Leukemia is involved. There will be lymphadenopathy. So the children, Either it may be a acute or subacute infections, but the lymphadenopathy can be seen like a infectious mononucleosis or even uh, German measles. But it also can be given for those children in which uh, there is symptoms of cancer actually, the real psychotic, the cancerous symptoms. So this will be the general constitution, generally specifically for a female and then specifically for a child. Now going towards the physical general, the pain, as I told, it will be arthritic and rheumatic pain as a sequel of suppressed gonorrhea. There is a soreness all over as is bruised and what we learn in arnica, baptisia, petroleum, like similar. There is trembling all over the body, but it is subjective. That means the person is feeling that he is trembling, but we don't see it, or there is no objective. The people who are observing him, the doctors or his caretakers, they don't see any trembling, but the patient will be feeling a trembling always that is subjective to himself. With profound exhaustion, there is a state of collapse and he wants to be fanned all the time, especially during the terminal stage. He will be having that intense burning of his body, and in that state of collapse, like carbo wedge, he always wants to get fanned. Craves for fresh air. The skin will be cold, yet throws off the covers, like that in case of cecal cord and camphor, and bathed with cold perspiration. But that is the situation which is happening towards the end in the collapse condition when the person is not getting enough oxygenation at that time. Otherwise, generally, the patient will be having that burning sensation, and in burning sensation also, he doesn't want to be covered. He wants to remove his blanket and get fanned. In mind, we saw that children will be very dull in nature. So even here we can see, and this is actually a terminal feature. More of this will be a terminal feature when the even the mind and its cognitive functions are affected or getting deteriorated. I have taken a snapshot from the other book. It is that homeopathy remedy pictures, in which it shows that another, like the starting of the mind, how it would be and how it come towards the terminal stage. That I have kept towards the last. We'll go through that. But here, this is the terminal stage that is Alan's have explained. There is a weakness of memory. They can't remember names. They can't remember others' names, and luckily they don't remember their own names also. They can forget the words, initial letters, has to ask the name of the intimate friend. So the friend doesn't bother that, oh, my friend has forgotten my name. The truth will be the person, the patient would have forgotten his own name. So mostly that much cognitive functions have got affected. He cannot spell correctly, wonders how a well-known name is spelled. He constantly loses the thread of conversation. So question has to be repeated and she loses herself. Again go. It's not like that of Lachesis. From one topic she loquaciously going into some other topic. Not like that. But the person is, when he is trying to speak, he forgets what he wanted to speak and then he loses his conversation. He will be like what we were talking about, and then because of that the question has to be repeated. And she cannot speak without weeping, anticipates death, because obviously the person is in a terminal stage, and if he is realizing that, obviously they will be anticipating death. But there is another thing also, they actually feel things that something is going bad to happen, like a prophesying something. They could feel that, and mostly it happens correctly also. So they can have that ability of prophesying or anticipating something bad, and then it is not just a scare or fear that is having in them, it is going to happen. Usually they are very sensitive to such prophetic nature. Then they are very nervous, extremely sensitive, and whenever we say a person who is having a nervous temperament, like Ignatia or Theridion, tarantula, then other nervous drugs, agaricus. All these drugs, they have this symptom. They start at the least sound, even it is. So it's a general nature of those persons who are extremely sensitive and also nervous. They will be struggling at the least sound. Then time passes too slowly for him, like alumina, argenta nitricum, cannabis indicus. We have already seen in case argenta nitricum. I don't know whether it had reached, but yeah, in comparison, when we were doing some comparison, we have done that. Argenta nitricum, the time passes too slowly for them, but they will be doing things in so haste. They will be in a great hurry. Things they will be doing in a hurried manner, but still it won't be done very efficiently or something, uh, and she will be doing that things in a hurry until she gets fatigue. And many symptoms are aggravated when thinking of them, or thinking of the complaints aggravate. And this we have studied in uh, yeah, in Helonius. In Helonius, and when I was saying Helonius at that time, I have said this comparison also. When they are thinking about their complaints, they have the aggravation. So we have that aggravation from thinking of the complaints in Medorinum, Helonius, Calcarea force, oxalic acid, Barita. And amelioration, I told you only two remedies: camphor and hell, camphor and Helleborus. Amelioration from thinking of the complaints. While all the other remedies, it will be all the other not all the other remedies whatever I told. So in case if it is coming in a MCQ mostly, I may not do that, but still. Among the list of the remedies, if camphor and Helleborus can be removed, the other one probably you can spot it out easily. If you just remember which is the ameliorating one, you can connect easily which is the aggravating factors. So calcareous, oxalic acid, and Medorina, mostly com, that is having aggravation from thinking of complaints, and also Helonius, yes, it's COM. Then in head, as I already told you, they will be having pain in the back of the brain, especially in the cerebellum region or the base of the brain. And that pain will be burning in nature, and this pain will be extending down the spine. The person will be having a tendency to draw the head backward. So I'm never going to ask you say the symptom Medorinum head symptoms, but this I kept in case it might be valuable when it comes for a clinical practice, because as I told, the main area of affection is in the spine. So the area in the cerebellum it is affected means it's actually from the spine is actually starting. So from the base of the brain. So you can connect the symptom like that. That is why I put the symptom head over there. Otherwise, for exam purpose, it is not much important. But remember that location, the spine affections, which means even in the head, that pain that will be starting from the cerebellum or base of the brain and then extend all down the spine. And because of the pain, the person will be having a tendency to draw the head backward, and pain will be always burning in nature. Then in throat, this is not much important, but because of its similarity with Mercurius, that's why I just put it over here. So in case of Medorinum throat, there is sensation as if she had taken a very severe cold. Throat is sore and swollen, and deglutition of both solid and liquid is impossible, and the throat is constantly filled with thick grey or bloody mucus, especially dripping from the posterior nares. So some symptoms very similar to mercurius. That is why I put it over there. And that also mostly clinically, because this is something that you might see in your clinic very frequently. So at that time we may get confused with mercurius also, and generally we will have a tendency to give mercurius because mercurius action on the throat is more pronounced than any other remedies. So we may not remember medorinum even at that time. But good to think, because if you get the history, not just an acute complaint, but the history of some cancer disease in their family, gonorrhea, then we can think about this acute complaint. I'm more curious if it is not acting to think about a miasmatic remedy, Madorinum as one. Then appetite. This is important for MCQ wise. There can be ravenous hunger or very intense hunger immediately after eating, like cinna, sulfur, sorinum, lycopodium. Then there might be constant thirst, and thirst to that level that the patient is dreaming that she is drinking water. There will be insatiate craving. Insatiate craving means craving itself shows desire 3 plus. Not just desire, but intense desire is what craving is. And insatiate craving means which is showing the increased or the superlative um, degree of craving. It is not just simple craving. The person is having a never ending or a that much intense craving, not desire, not just craving, but insatiate. He is not satisfied with that. That much craving he will be having for liquor, for all the things which he hated before. Oh, sorry. For liquor, which before she hated. So earlier she may not have liked those things, but now she's having an insatiate craving for liquor. For salt, this is characteristic for salt. For sweets, for ale, ice, acids, oranges, green fruit. So this is important clinically, of course, yes, but also even for MCQs. The dreams that she is drinking and insatiate cravings for ice, acids, oranges, green fruit. It can be asked for MCQ, and even for prescription, it will be like very much surety if we get such desires, not just desires, that craving in them. If we get that, it is that much indicated. In case of bowels, lot of symptoms in bowels, but it is the characteristic position they take in to pass the stool. That makes this one important, and that too for MCQ. The person can pass stool only by leaning very far back. They go back and then only they can pass the stool. It is because of some protrusion, anal protrusion, rectal protrusion that is happening over there. But the characteristic position that they can pass stool only by leaning very far back. That's the characteristic attitude they take in. And also there is a very offensive nature or spelling moisture oozing out from anus, and it will be having the smell of a fish brine, a particular type of fish, the uh, herring brine. It's some liquid in which that has been stored, and it will be very offensive. So that will be the kind of smell for the moisture that is oozing out. And we have other two remedies with the same symptom, causticum and hepasulf. In urinary organs mainly because they may have nephritis, the glomerular nephritis or the nephrotic syndrome. So maybe there is albuminuria or hematuria, or because this is a psychotic remedy, this is also maybe because of nephrolithiasis or because of this renal stones. So it's pain, the renal colic and the hematuria related to that. So that makes the urinary complaints very important, and also gonorrhea related. So that symptoms will also be the. So in urinary organs there is severe pain, especially in the renal region, and that is ameliorated by profuse urination, and that shows the problem is related, some congestion in regards to kidney condition. So that pain in the renal region will be ameliorated by profuse urination. There will be renal colic also, colicky pain, the renal colic or the uterine colic, the pain the patient feels, especially when the stones are coming out. So the intense colicky pain in the ureters with sensation of passage of calculus. That is that characteristic renal colic when the stone is passing through that uterine, not uterine, sorry, ureter. Then along with that there will be craving for ice. Along with this renal colic and that intense pain, the patient will be having that craving for ice. This is very characteristic. And then another thing to be noted over here is we have a comparison for renal colic, that is the Berberis vulgaris and Lycopodium and Ocimum canum. And when we see the side, I'm not sure whether you know it or not, but Berberis vulgaris, do you know which side the renal colic they are having? Any side preference?
Left.
Yeah, Berberis is having left side, and Lyco
Right side.
is Lyco is right, and same is with Ocimum. Ocimum canum, it is also having right side. But in case of Medorinum, we don't have any such particular side, right or left. Whatever be that, even if it is right-sided, even if it is left-sided, if we get the symptom similarity, Medorinum. And Medorinum will be mostly chronic and constitutionally prescribed. Like this, when we go towards the rheumatism, the shoulder pain, over there also we will be discussing one symptom, the pain in the shoulder. So there also you will see the comparison. If the pain is in the right shoulder, then a particular medicine. If the pain is in the left shoulder, then it is another medicine. But if it is pain in both the shoulders, then medorinum is the medicine. So in urinary organs, likewise, though all the comparisons over here, Berberis indicate left-sided, Lyco and Ocimum indicating right-sided. For Medorinum, renal colic can be both-sided. There can be nocturnal enuresis. They pass enormous quantity of ammoniacal high-colored urine in bed every night. And that is aggravated by overwork or overplay when the best selected remedy fails with a history of psychosis. So in kids, when we have given a lot of remedies, sepia, creosote, and when it is not working, we can think about, especially if there is a history of not just of enuresis, but anything that is related to psychotic miasm. And in sexual organs, menses is characteristic. There will be dark clotted blood and the stains will be very difficult to wash out. Metrorrhagia, I told you during the climacteric period, and metrorrhagia is the menses happening in between two menstrual periods. So metrorrhagia, if it is happening around climacteric, means after like the woman is attained menopause and then a bleeding is seen, profuse bleeding, the first thing to be doubted is whether the patient is having cancer or not. Immediately you have to send, once the patient have attained uh, this one menopause and profuse bleeding is seen in her, immediately she has to be sent because that can be a sign of cancer. So metrorrhagia at the climacteric time for weeks where the flow is dark and clotted, it almost always indicate malignant diseases of uterus, and this will be very offensive. All the discharges over here, because it is psychotic miasm, it will be very offensive. We saw even in the anal discharge it is very offensive. So even the metrorrhagia will be offensive. It is dark clotted and can be also during movement. And during the menstrual colic, when it is not the metrorrhagic colic, otherwise a young lady who is having a menstrual colic, she will be having a particular attitude as like what she does, I mean a different attitude taken in respiratory organ. This characteristic will be like drawing up of knees. So she will be lying on her back and then bringing her knees towards the chest region so that the abdomen is getting pressed, and that kind of posture, sometimes they may take a posture in which they are going to press their feet on something harder. Like either they lift their leg, or bend the knees and then bring it towards the chest region, or they may be keeping the legs folded and the feet touching on the bed. The attitude that is advised in women undergoing delivery. For delivery, that is the posture they usually take. So that will be the posture a lady who needs medorinum will be taking during her menstrual colic. And that shows her intense dysmenorrhea, and this type of dysmenorrhea is usually pathological, because we have another type of dysmenorrhea which is spasmodic dysmenorrhea, which is usually seen in normal females, all the females during their menses. It will be like spasmodic. It will be coming and going. It will be coming and going. The uterine, it will be undergoing spasms in between, so as to throw out the uterine bed that was formed for anticipating a union. So at that time, the females will be having a spasmodic dysmenorrhea, which is quite physiological. But the congestive dysmenorrhea, that is what most severe is, and that always shows if a lady is presenting with congestive dysmenorrhea, it is a very serious condition, and it shows there is something pathology inside the female reproductive organ, some pelvic inflammatory diseases, some infection that is over there. So that is congestive type of dysmenorrhea. Here the pain will be starting 3 or 4 days before menses also. So this lady, the lady who needs medorinum, she'll be having that intense menstrual colic or the congestive dysmenorrhea, and she feels amelioration by drawing up the knees towards the chest region. Or the second posture might be pressing the feet against something stronger on the bed or on the walls, something very stronger like that. A position that she might take during the labor. Breast will be cold as ice to touch, especially the nipple region. Rest of the body is warm, and that is usually seen during menses. In respiratory organ, she will be having asthma with a choking sensation, and the particular position that is taken is amelioration by lying on face and protruding the tongue. So imagine that posture when I say lying on the face. Leave the part the protruding tongue, but lying on face, like when we go to temple, we do a kind of bending, a similar bending Muslims also do during their prayer. So this posture it is usually called as Mohammedan prayer posture, like that you remember. So the posture will be like lying on face, and usually in temples when we go, the males will be actually lying completely, like in a supine position, not supine. It will be prone position, the complete body. But how the females bend their body, that posture, the half prone, that is how Medorinum will be taking. Similar, very much similar to that of the Mohammedan prayer, but only thing is the even the tongue will be stuck out. So that is a characteristic position the patients, the asthmatic patients take in case of Medorinum. They can inhale with ease, but there is no power to exhale. And back and extremities, the pain in back between scapulae, the whole length of spine is sore to touch. We have seen that heat which begins from the nape of the neck extending down the spine with a stiffness which shows their rheumatic nature, and that is aggravated by stretching. And this one, what I told you, rheumatism of both shoulder and arm. Pain will be extending to fingers and aggravation from motion. So if it is the right shoulder that is affected, or pain in the right shoulder, we can give sanguinaria, and if it is the left shoulder, we can give ferrum. And this one, medorinum, I have not tried because I did never got this both shoulders affected, but this one I have tried, especially the left-sided shoulder pain, ferrum metallicum. No other indication, okay? The patient didn't have any other indication, but it was just the characteristic feature that the shoulder pain in the left side. So I tried with Ferromet and it worked actually. Then heaviness of leg, or feel like lead, walking very difficult, legs are so heavy, legs give way. When I read this sentence, you may be remembering even the tuja. The drug tuja is having something like that. They also feel like a lead, the feet has become like a wood or glass as if it is going to break, that heavy sensation. So even in Thuja and also the other antipsychotic in Medorina are having that feature. That's why I kept over here. There is restlessness like that of especially of legs and feet like Zingamet. And the patient's complaints usually will be aggravating during an electrical storm like that of phosphorus or even sorinum, rhododendron. Then there can be cramps in calf muscles and soles like cupramet. Ankles easily turn when walking like ledam. There will be burning of hands and feet once them uncovered and fanned. In this one we have discussed the burning of hand and feet. I told you they want them to be uncovered and fanned. These cramp symptoms. When the patient is having cramps, we can give some acute remedies like cuprum, uh, Nux vomica, ignatia. Cuprum is most effective. We can give cramps for that. But if the patient is having a chronic complaint, not just an acute affection, but a chronic crampy condition, then medorinum is something to be thought of. Then even this one, ankles easily turn when walking. Usually that an acute remedy will be carbo animalis or even ledampal. But when you give that medicine, the patient is okay then. But if he is having a tendency of constantly this ankle getting dislocated, uh, can give with medorinum. Burning of hands and feet wants them uncovered and fanned. Uh, then deformity of finger joints. There will be knuckles which will be large and puffy, showing the rheumatoid arthritis, the typical RA. You know, typical RA, it will be the small joints that will be affected, and it will be after towards the terminal or a chronic condition after so many years, these fingers will be having some kind of deformity. Um, so that deformity of finger joints, knuckles will be large and puffy, swelling and painful stiffness. You can think about medorinum. And they have generally amelioration at the seashore, amelioration lying on stomach, like the asthmatic condition we told, lying on a prone position, lying on abdomen. Damp weather is also amelioration. So that is actually medorinum in Alan's keynote, but I think because though it is very vast, I think at least a few points you might have got it. Just connect it with the psychotic mechanism, that characteristic burning pain, aggravation, amelioration, and then the affections, the female affections, PID, the pelvic inflammatory disease. And then all the particular attitudes, especially in the menstrual colic, what they do during asthma, the position that they take. So you can connect like that and all together, and their particular desires and their craving. Uh, that alone will give. That's enough for Medorina. This is from who's that? Vitorkas, I guess.
Yeah, this is Vitaukas. Vitaukas compass.
Okay. So, because only a part of it I have added. This is basically the notes prepared by Te. A few slides I have had added. So that's why it is coming from the compass. So the Medorian persons are very passionate with everything they do. They're passionate in their relationship, their belief, their interest. They're very sexual. They enjoy sex as long as the passion lasts. They enjoy the sea and they have marked amelioration in the sea. They usually has a history of venereal disease or early heart disease in the patient's or his parents' history. Then they will be very much accelerated at night. Powerful, extrovert, egotistical persons. Uh, they put passion in whatever they do, but they you can get also the very opposite type who is very introverted and not able to express themselves. Fear that somebody is behind him. There are very rapid thoughts going on. That's why they lost the thread of when they are talking, and they are also hurried in nature, but time passes too slowly for them. In physical, there will be personal or family history of venereal disease such as gonorrhea or heart affections in young age. There will be gonorrheal discharge, urethritis, condylomata warts, herpetic eruptions in genitalia, red rash in the genitalia of newborns, general amelioration in the evening, hot blooded or warm blooded, which means there will be hot feet and covers them at night. Usually, medorinum. Sometimes when my mother says some symptom, especially she has got some urinary complaints, I feel very much similar to like that of Tuja. And she has a constitution of Tuja also. But when I give Tuja, I never got a result, or I'm not satisfied with the result of Tuja, and then I give Medorinum, but maybe because of the potency that I chose, it's not matching. Even Medorinum, I always wonder why it happens so, because medicine I'm so damn sure of it is Medorinum or Thuja. I mean, it is indicating a psychotic miasm that is lurking behind. But I don't know when even I give probably the potency is wrong, or repetition was too early. I really don't know. But I have never got a good action or a satisfactory action. Some action I will get when the symptoms go on for some time, but then it will be reappearing. And that too not after long time. If it is appearing after a long time, then also I would be happy, but very soon it will be reappearing. So even exam wise also I don't like Medorinum, studying Medorinum. Even practical wise also I don't like giving Medorinum. But now another condition that I don't know its result, I just tried with Medorinum. One of my uncle, he's having what is that complaint? Burning of feet. So the first medicine that I gave him was phosphorus, because he do have a phosphorus constitution. So that is why a phosphorus nature. That's why I gave him phosphorus. But he told that he didn't feel any relief from that medicine. So then he's a bit hypochondriacal also. I thought, okay, I will try with Medorinum, because he is having some heart complaint also. So I just started with Medorinum, not frequent potency because of the history also. I'm just waiting to see whether there is any result that is going to happen. If it is happening, I will let you know if I remember. It just started last week only. So painful soles cannot walk on beach pebbles easily, sleep on abdomen or in knee chest position, asthmatic respiration, amelioration in knee chest position, constant disposition to hawk due to mucus stuck in the throat. We saw the Merc symptom. Modality amelioration in the sea bathing, seashore, amelioration in evening, lying on abdomen, aggravation cold wet weather, becoming cold. Desire for sour, orange, acid, green or unripe fruits. Alcoholic drinks, especially sweet. Ice, sweets, what we told earlier. Salt. The desire for ice, don't forget it. They are the people who can eat the raw ice, simply put in their mouth and eat. Aversion to aubergine. In Kent, it is one of the medicine given for children who are having inherited complaints. So the physician of long and active experience meets many obstinate cases in children. The infant soon emaciates and become marasmic, or a child become asthmatic, or suffers with vicious catarrh of nose or eyelids, or has ringworm on the scalp or face, or is dwarf, And after some waste of time, it comes to mind that the father was treated for gonorrhea, which was very obstinate. Or maybe the person had, his father was having condylomata, which shows the history of psychosis. And then you think about medorinum. So maybe the patient was coming for a long time, and then the baby started showing either of these symptoms, and you're trying some acute remedies, it is not working. And then, if you remember, the father had such a history, try giving medorinum. It will solve the case. Another one for a woman who is married several years and now she is desiring to become a mother. But after this much years, she is having ovarian pains, menstrual complaints. She has lost all sexual response, is becoming anemic, and very violent, sensitive, and also nervous. And these symptoms indicates her PID or pelvic inflammatory disease, which can arise due to some sexual infections. So maybe the husband history gives the cause, and this remedy will cure. In case of young men who are anemic and also who crave for stimulants and tobacco, who are very sensitive to cold draught, becoming stiff after exertion, extremely sensitive to cold, who have never been since having a gonorrhea, can be given this remedy. So this is a statement by Kant, because aptly, because rheumatism is a complaint that is being covered both in syphilinum and also in medorinum. And generally we say that syphilinum, it is having aggravation towards night, and medorinum, because it is a psychotic remedy, it is having aggravation in daytime. But Kent is saying we can't say easily like that a black and white situation. That syphilinum is always at night and medorinum is always at daytime. We can't say. Because most of the symptoms, many of the syphilinum patients are worse at night, and many of the medorinum symptoms are worse at daytime. It is also true that many psychotic symptoms are violent day and night. So it is like a gray shade. It is, we never can say all the symptoms of medorinum is aggravated at the daytime. It can happen in nighttime also. It is also true that the mental symptoms of medorinum are most violent at night. The rheumatic inflammations are worse from motion, but when swelling is not there, the patient is almost like rust patients. When we are saying the symptoms in the rheumatic complaints, we saw it is more like rust strokes. There will be the small joints swelling, painful, inflamed, etc. But here Ken says that if usually this will be aggravated from motion, and when we compare that symptom with rust strokes, we know rust strokes will be having rest aggravation, and continued motion is an amelioration. So in case of medorinum, usually they will be having opposite symptom to that of rust strokes, that is aggravation from motion. But if there is no swelling present, if it is swelling present, then that is this condition. But if there is no swelling present, it is almost similar to rest patient. The patient is sensitive to cold, there will be aching pain, and patient find relief only in motion, like that of rest strokes, if no swelling is there. Can be given for obstinate cases of rheumatism, losing flesh, even in rheumatoid arthritis, because it is an autoimmune disorder. If you remember the symptoms, or any kind of arthritis where it is the autoimmune disease, towards the later, the general health will be affected. The nourishment will be affected, and that will be shown as a wasting disease in his body. So there will be losing flesh, walk stoop shouldered, become very clumsy. Clumsy means tendency to easily fall. They stumble, they can't even hold things. Joints will be becoming deformed, as if he is going quick into consumption state. There will be nervous sensitivity, trembling, intense formication all over the body. Intense formication, I hope you understand. It's like some insect or worm is crawling in their body. It is not actually the worm is going through, nothing like that, but they have a sensation that something is crawling over their body. It can be a symptom that is seen in varicose vein, and medorinum is a good medicine for varicose vein. And it can also be seen due to some nervous complaints, this formication, and also in cocaine, too much cocaine using or cocaine poisoning, we can get that symptom. The patient starts from slightest noise, feels pain and wants to be fanned, cold and pulseless, especially in collapse when the patient wants to be fanned with cold sweat. Edema of the lips, which shows the varicose vein and any other kind. They're subject to neuralgias. Pains are ameliorated by heat. The patient is extremely sensitive to pain. The remedy should never be used in low potency. As the mind symptoms, they're very forgetful. We told that time moves too slowly. She's in a hurry. Difficult to state her symptoms without losing the thread. Think that someone is behind her. Hears whispering. Changeable. This is one we didn't say. Changeable state of mind. One moment sad, the next mirthful. Like Pulsatilla, Crocus, Ignatia. They're having a changeable state of mind. Even Platina. Presentiment of death that we told. Anxiety about her salvation. This is the picture that I have taken from the other book. And here also it is almost saying what Vitolkas has told. That similar to Tuja, this is one of the remedies for the psychotic miasm, where the ancestors have suffered from gonorrhea. Then the word "to" is very characteristic over here. Like in case of medorinum, it can be in both extremes. Either the person is too extroverted or too introverted. We can get the both extremes over them. So either the person is hypertonic, boisterous type, too loud, too fast, too wild, too colorful, or he can be also extremely introverted, too shy, too kind, too gentle in nature. And that can confuse us also with other similar type of gentle remedies. And sometimes he will be too excited that he wants to experience everything very intensely. A fast car, many love affairs, alcohol, loud, wild music that attract him. Then on the physical level, Medorinian types often suffer from affections of the skin and respiratory tract or rheumatic complaints, so genitourinary symptoms. The secretions which are very offensive, the smell of fish brine. And later stages of the pathology, what I told you, the increasing mental symptoms were even the cognitive function is being lost. So, as like that last class, we have some pictures. They decide for extremes. Is not interested in whether anything is prohibited. They even if there is a speed prohibition, they don't care. They want to go the maximum speed. And then they are great in haste and hurry, but still nothing fruitful will be coming out. As problems when a time is set. This is a medicine with extreme contrast. One phase they may be hard and cruel, but the other one it may be very kind and sensitive. May be fond of animals or cruel towards animals. Then you may be full of energy or completely lethargic in nature. You may be mentally very, very alert, but then we get the exact opposite, totally forgetful also. So both the extremes a Medorinum person can exhibit. The fear that there is someone is behind him, and while talking, they are going to forget what they were supposed to talk. They lose the thread. Family history of heart disease at an early age, and being by sea ameliorates all complaints. The characteristic Nietzsche's position that they take, asthma, which is accompanied by skin complaint, and lying on knees and chest ameliorate. And then there will be chronic coryza. See the chronic coryza, starting from the baby to the even the old age, there will be a chronic coryza. And this one is actually a link to a particular case, and I thought I will read it and concise it, but it is so difficult because it is a 20-year long condition of an autism starting from 1996 and saying about 2016 until 2016. So in one of the phase they have given medorinum, and you can just go through it and see how uh, how they felt it could be tuberculinum. It's something that struck to them that it felt no, it should be medorinum, and how did they treat the condition with medorinum? Because it's so long, just go through this case in this link. So that is with medorinum, and we go to the second medicine, Melilotus alba. Melilotus alba, the common name is sweet clover. There is white melilot, but doesn't matter because you're not going, never going to get a question where a melilot is there. So it will be sweet clover that you need to study, belonging to the family Leguminosae. Non-effects: dried leaves can be toxic, though the fresh leaves are quite safe. This is due to the presence of coumarin, the substance that gives some dried plants the smell of new mown hay. Taken internally, it can prevent the sorry, blood from clotting. Usually seen in field and waste places on dry, not acidic soil. Tincture of whole fresh plant in flower is used for preparation. So here, the characteristic feature of Melilotus is usually the question that can be asked for Melilotus will be hemorrhage, like the short note that I asked you, Melilotus in hemorrhage. That will be the usual way in which Melilotus will be asked, and the important symptom or the characteristic feature of their hemorrhage is they will be having a congestion. Before the hemorrhage starts, there will be a congestion. And any part of the body it is going to bleed. Before to that, the face will become intense red. And once the bleeding happen, it can be a nosebleed, that is an epistaxis, or from any orifice of the body, the patient will be having a general relief. So that is the in total about Melilotus. Just one symptom to remember, usually given for hemorrhagic condition, and hemorrhage from any part of the body is going to be an amelioration. And before to hemorrhage, there should be actually congestion. And that congestion may be very visible on the face also, where the face become very red in nature. That is put in short Melilotus. And then we'll go what is there in the text. The religious melancholy with an intensely red face. Insanity in early stages to relieve brain from pressure and irritation. Usually this congestion we can compare it with other drugs like aconite, belladonna, glonoine, sanguinaria. So in this in all those dose drugs also we know that the person will be having, because of that congestion, that red face will be having. And basically we go for the nature, because this is a medicine usually given for acute complaints, but even the provers have given the symptoms like maybe it is associated, a very normal person is never going to bleed that easily, some or the other organic affection should be there. So maybe the person is in know that he or she is having a very serious disease, and then they are like in a religious melancholy, or like they become so religious in nature, somewhat sad always, thinking about her salvation, like that nature. And then the face will be red face, and that in religious melancholy and red face don't connect it, just connect because of the congestion. The face will be very red in nature, and mostly these persons will be having organic affections, so they will be religiously very affected also, worrying about their salvation, etc. Maybe going towards a insanity condition, to relieve brain from pressure and irritation. But I have never seen someone giving this medicine uh, just to like for insanity, to relieve brain from pressure and irritation. I have never seen. Congestions which is relieved by hemorrhage, engorgement of blood vessels in any part of the organ. There will be congestive or nervous headache, and epistaxis or bleeding from the nose is going to give relief. Other medicines are Ferramphos and Euphorana. There can also be convulsions because there is congestion of blood in the head region or anything like belladonna. There can be convulsions, especially during dentition, or not the typical convulsions. They can have the infantile spasm, the eclampsia, or the epilepsy. In case of nosebleed, before to nosebleed also there will be intense congestion or rush of blood to the face region, making it very red, flushing of face, and also with that throbbing of carotids. So the person's face become very red, the throbbing carotid is seen. Only that much we see in case of belladonna. Belladonna also there can be hemorrhage and it will be bright red profuse hemorrhage. But in here case, in this one Billy lotus, this one that intense congestive phase, that reddish phase, flushing, throbbing of carotid, it is followed by nosebleed. And once the nosebleed or any hemorrhage happens, the patient will be having general relief. Then very red phase precedes hemorrhage from every organ. Any organ is going to bleed, it doesn't matter, the face will be becoming very much reddish. There can be constipation, and usually this sentence I have seen in case of as in a MCQ, because ultimately Meli lotus, when it comes to exam point of view, what we remember will be congestion, the face red, any bleeding, any hemorrhage, that is going to give amelioration. We are going to remember only that much sentences. So anything related to congestion and hemorrhage. But this one, there is no desire to pass stool until there is a large accumulation. We are definitely going to forget that, because we have such a lot of remedies in our armor for constipation. We are not going to remember, usually we are not going to remember Meli lotus for constipation. But that's where the questions arises. So in MCQ mainly, constipation, where there is no desire to pass the stool until there is a large accumulation like that of alumina. This is a good medicine indicated in constipation. There can be painful constriction in anus, throbbing, fullness, doesn't matter. In the constipation, and there is no desire until a large accumulation of stool, that is the important feature. It is aggravation, approach of a storm or rainy, changeable weather. And this I think it should be from the boric, and no, seriously, for the exam purpose I wouldn't say you to study unless this reddish colored one, but we can go through it. So the main thing, congestion and hemorrhage, hemorrhages itself, that's the key word. And in mental, there will be psychotic condition, mania, insanity, delusions, religious affections. We saw that delusion that everyone is possessed by devils, that everyone is looking at her, that she is pursued by police or enemies, and he is about to be arrested. They wants to run and hide, think that everyone is looking at her. See? Inability to study or with a weak memory of its word and letters in writing. And in congestion,
Okay.
in congestion, there is a full sensation or full feeling in internally, all the blood vessels being filled up. There will be pulsations which can be felt internally and externally also. Blood vessels get overfilled as if they are going to burst, which actually they do. That's the thing. We can see this symptom that it is going to burst in case of glonoin, And then another medicine is the which is that medicine? Do you remember that medicine that which is given for hemorrhoids starting with A? It is also very characteristic, as if all the blood vessels in all over the body has become engorged with a sensation as if it would break. Oh, aeschylus. You can see that symptom, that fullness of sensation in aeschylus also. But in them it is only a sensation. But in case of melanotus, it is not just a sensation, as if the blood vessels will be burst. It is actually going to happen. It can result in any hemorrhages, epistaxis, um, on or from any orifice. The violent throbbing headache with congestion and red bluish face, fullness all over, amelioration of headache with epistaxis, or menstrual flow or profuse urination. Uh, and also application of vinegar lead off. Black spots seen before the eyes, cold feet, red face, or mentioned during the headache. Forget it off. Too much symptoms. Then in case of dysmenorrhea also we can give. But in case of dysmenorrhea, notice that there is menses that is scanty. So everywhere we say that there is hemorrhage, and hemorrhage it is actually giving amelioration for her symptoms. But when it comes to dysmenorrhea, the menses is very scanty in nature. So just remember the congestion, hemorrhage, nature of blood, and everything that is feeling amelioration after that passage of hemorrhage. In case of headache, even any hemorrhage from any part of the body, or even from the nose, the epistaxis, or even profuse urination like that in gelsemium, clonoins, sanguinaria. That congestion, when it is relieved, the headache will also be relieved. Then the third remedy for today is Mephitis. So Mephitis or the Mephitis pictorius, or the common name skunk, we take the dilution, alcoholic dilution of the liquid that is seen in the anal glands of the skunk. So in cluck or Mephitis, it is actually put in very short. Mephitis is a good remedy for cough with choking or whooping cough, and then the person will be having amelioration from having a very ice cold water bath. That is the main feature. Now we'll go into their symptoms. Mephitis is not given in. Yeah, we'll start with cluck. Mephitis was proved by Herring in the 30th potency. Among the symptoms he developed was choking while eating or drinking, and cough on reading aloud while talking and after drinking caused by choking. But these symptoms, cough on reading aloud while talking, we can see in many other cough remedies in Drosera, Spongia, Stanamet, um, Argentum. You can see these symptoms. Least use of voice or the vocal cord can bring about cough. Lower ribs is painful to touch or pressure, especially aggravation from coughing or sneezing. And Neidhart, he had given Mephitis to a young man afflicted with symptoms of consumption. Consumption is the another name used for tuberculosis. And in that person, there was a spasmodic cough with a crowing sound, lasting all night and returning several times. So to that person, when he gave Mephitis, it was cured. Guernsey says that whooping or any kind of cough which is very violent, coming on spasmodically, and each time each attack will feel as if the person is going to die. Such a type of cough, Mephitis is indicated. Farrington says that the Mephitis is, the nervous exhaustion seen in Mephitis is highly characteristic. In whooping cough, the catara is very scanty. The whoop sound will be there, and aggravation at night and also lying down. The person will be having suffocative feeling. He can inhale, but he cannot exhale, like what we learned in Medorinum. And in most of the respiratory complaints, inspiration is actually easier, but it is the expiration that is difficult. Though it is the inspiration that is the active process, and expiration that is the passive process. That's how we study. But expiration is kind of very much difficult. Uh, Not in asthmatic condition, especially conditions of emphysema. So there will be difficulty to exhale out. Vomit food sometimes hours after eating. Asthma of drunkards and consumptive patients or TB patients, especially after Drosera. It's another case of TM Stewart. He says a person or a man of 47. He had a constant hacking cough coming on during conversation. And for that complaint, he amputated his uvula. My God. As soon as he recovered from the operation, the condition was this: cough after reading aloud or drinking any fluid, cough spasmodic, hollow, hoarse, aggravation at night and on lying down, and it is loose in morning. So he was given ambragracia, chamomilla, calibi, rumex, phosphorus. And this case I liked actually, because over here when I see the other case, which is given by Neidhart, I really don't get any symptom from this sentence alone. Why Neidhart gave this medicine? Because here it is just showing spasmodic cough with a crowing sound, and that's not the feature of Mephitis. I mean, yeah, it is given for whooping cough, but whooping cough, it is not the Mephitis is the only remedy. We have a lot of remedies. So what made him give this symptom? I mean, with this medicine, lasting all night, returning several other times, that gives a small clue, but still, I don't know what particular indication he got to prescribe Mephitis. But this one seems more like something, as like what we also do, because here the symptoms are very much confusing, very much commonly seen. So ambra, chamomilla, calibi, rumex, especially leave ambra and chamomilla, but calibi, rumex, phosphorus, every whoa, the cough, reading aloud, drinking any fluid, cough that is spasmodic, hollow, hoarse. So these remedies failed to relieve, and then he was given Mephitis 1 m, or maybe that was the only remedy then remained to prescribe. Anyway, that cured promptly. Another point about Mephitis is the rush of warmth it causes to various parts. So because of that warm sensation spreading all over his body, he is able to endure extreme cold. Makes them less chilly in cold weather, so they prefer to take bath or washing in ice water, not simple water. Washing in ice water is pleasant. And you should remember the symptom Mephitis, that whooping cough, that growing in nature, which is the specific feature of whooping cough. The thing is, these remedies were always, remember that it was proved in Europe, UK, that part area. And in that area, a person who is preferring to get washed in ice water, it is not a simple modality. We can't compare this one to a tropical country like India or some other place. So it is not in India. If someone is saying they like to wash in ice water is characteristic. We can definitely think about Mephitis. But when it is told by a person who is not coming from a tropical country, then it is plus 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 more indicated. According to Herring, Mephitis has a very short action and it is antidoted by camphor, but only temporarily. In case of Mephitis, a great medicine for whooping cough. In order to ensure its full success, it should be given in lower dilutions, especially from 1x to 3x, given by Boric. But Boric always prescribes to give it in all the small potencies. In our maximum, he says is 30C, not more than that. However, this medicine was also proved in the smallest potency 30C. There will be a suffocative feeling, asthmatic paroxysm. Spasmodic cough is so violent, seems as if each spell would terminate his life. Child must be raised up. You may feel that cyanosis because of the whooping cough, and that's the characteristic feature, not characteristic feature of the drug, but characteristic feature of the disease. In whooping cough, when there is a whoop is there, the person is not able to exhale out. Definitely, there is going to be some cyanotic features in his face. It become bluish in nature. So the child after this attack or during the attack, it becomes blue in the face. They cannot exhale. Mucus rails through the upper part of the chest, and the patient wants to bathe in ice water. Mind will be excited, full of fancies, can neither sleep nor work. You don't have to remember that. Pain from exertion, unable to distinguish letter. No, leave it, leave it. Come to the respiratory. No need of all these symptoms. Respiratory sudden contraction of the glottis or laryngismus while drinking or talking. That is why they have that choking sensation. Food goes down the wrong way, like kawa kawa, then calicarb, cali or some calicarb or some cali is the medicine. Pipomethysticum. Mm. They cannot exhale, spasmodic and whooping cough. Few paroxysms in daytime, but many at night, especially when they are lying down, and they vomit hours after eating. Asthma as if inhaling sulfur, cough from talking, hollow deep with rawness, hoarseness, and pain through the chest. And in sleep, wakes up at night with rush of blood to the lower part of leg, vivid dreams of water, fire, etc. Just forget it. Just remember two simple sentences from the everything else you can add from your own. The thing will be that characteristic cough, spasmodic in nature, difficulty to exhale, especially the attacks will be during night while lying down, and that amelioration will be washing in ice water. Bathing in ice water will give all amelioration. That's the feature of Mephitis. Then it is Merc cyanatus. You need a 5-minute break. So I continue.
I think you may continue from okay.
So Merc cyanatus, this is also one of the small remedy. I think they had given symptoms from war. It is also there, but no, you just need to remember only from Allen's. A small paragraph is there in Allen's. This is a Merc remedy. So Merc remedy means definitely they are having action on their throat. So it is going to
重要。
uh, the throat will be affected. There will be diphtheria, that is the main symptom of Merck cyanitis. And diphtheria, it will be having a descending in nature, or it is going down towards. That is the only feature in case of Merck cyanitis. Other stories we can write just to make the paragraph bigger. Otherwise, usually Merck cyanitis will be something that will be asked only for a MCQ. Um, so going towards the drug, it is mercurius cyanitus, or common name bicyanide of mercury, HgCN2, and mode of preparation is by trituration. And in Ellen, because it is a mercurius remedy, definitely there is going to be some features of mercurius. There will be extreme weakness, extreme prostration. Remember the mercurius constitution, and they cannot stand up from weakness. It is given for diphtheria, malignant diphtheria. What do you mean when you hear the term malignant diphtheria? Malignancy generally means cancer, malignant condition. But diphtheria is never going to be a cancer condition. So what it means when in the literature we say malignant diphtheria, what is the meaning? Any random guesses?
Mm,
Someone please give me a reply.
is is it malignant means is it very harmful or severe throat condition?
It is very harmful, it's very serious,
Yeah.
and also spreading. Because it is diphtheria,
Okay.
you know the different types of diphtheria. It can be in the larynx, it can be in the pharynx, it can be nasal diphtheria, even in the skin. So, like that, though diphtheria is not a cancer condition, but in that local area it can spread. So, that is the word why, what they mean malignant diphtheria. Like a cancer, it can spread. So, the whole this area, the pharyngeal, laryngeal area, even the nose, it will be affected. But then, how it is spreading, that is the important feature. So, there is malignant diphtheria with intense redness in the facial region and great difficulty to swallow. And a common feature of the diphtheria, there will be a pseudomembrane formation, and that goes descending in nature or down to that in this nasopharyngeal area. if if it is opposite, if it is opposite means in case of diphtheria where the pseudomembrane deposit is ascending in nature, the deposition started somewhere down and then it is spreading towards upward the nasal region, etc. If it is ascending in nature, the medicine will be bromium. But if that deposition, the pseudomembranous deposition, is descending in nature, going down, then it is Merc cyanitis. It will be and it will be very putrid, or the discharge that is coming out, it will be very offensive, or the gangrenous diphtheria that is destroying all the tissues in that area. Or phagedenic ulceration, which means rapidly spreading destructive ulceration, membranous croup, etc., or laryngotracheobronchitis. There will be inflammation of larynx, trachea, and bronchial tube with the symptoms of cough. So the main feature, the ultimately Merck cyanitis, you have to remember that it is given in malignant diphtheria. And remember all the different ways how you can describe what is this malignant diphtheria. That it is very serious or rapidly spreading, and then there will be pseudomembranous formation, and the only symptom that which you shouldn't forget, it is descending in nature. That pseudomembranous formation, it will be descending or going down, it will be forming somewhere in the top layer and then going down, and if it is opposite, it will be bromium. When it corresponds to the genus epidemicus, like every other remedy, is effective as a prophylactic. So this was one of the medicine Hahnemann used when there was actually epidemic of diphtheria. But after we started, I don't know whether you remember DPT. No, that was so far I took. But even diphtheria we have discussed in some of the classes. When we were discussing about the vaccination for diphtheria, the DPT, because before to this vaccination, diphtheria was actually a very killing disease. But after the vaccination started, diphtheria is much reducing. But it later became a re-emerging disease, like people who are against vaccines, they came up and they told that the vaccines shouldn't be taken, especially for diphtheria, because of the influence of vaccination, diphtheria was almost getting vanishing, or not extinct, but it was vanishing. So the anti-vaccine, those group of people, they told that there is no need to take the vaccine, and then it led to the re-emergence of diphtheria. Once it was gone, but re-emerging. So this, if comes as a epidemic problem, as a genus epidemicus, provided the symptom similarity, and the only characteristic feature, the main characteristic feature of Merck cyanitis is that pseudomembrane formation should be moving, descending. Then this is a highly effective as a prophylactic or as a preventive. I say this is completely from Boric. I'm just reading it, but for the exam purpose, remember only what I told you. So Merck cyanitis, it is resulting in acute infection, pneumonia, nephritis. Its action is similar to that of the toxins of infectious diseases. There will be great and rapid prostration. Of course, it's a feature of diphtheria. And diphtheria, it is actually the Corynebacterium diphtheria which causes the disease, but it is not the bacteria that is attacking and that is causing the problem. The toxins released by the bacteria, that is the one which is causing this uh, problem in diphtheria. So there will be great and rapid prostration, tendency towards hemorrhages from different orifices. The fluid blood, the blood will be dark fluid in nature. There can be cyanosis, rapid respiration, and heart action is labored. Albuminuria and twitching and jerking of muscles. Um, the person might be livid, suffocation is imminent, and there is a threatened paralysis of lungs with profuse sweat. It mostly affect the buccal cavity with marked prostration. Remember that. In the treatment of diphtheria, it has achieved unquestionably great results. Malignant type with that prostration, coldness and nausea, syphilitic ulcers when perforation threatens. Then in mouth, they can be covered with ulceration, tongue will be pale, free salivation, halitosis. And when I say these symptoms are what we see in case of the tongue of Mercurius. The simple Merc tongue is also like this. The tongue will be very moist with lots of saliva and very bad smell of halitosis. Ulceration of the membrane will be having a gray membrane, or the pseudomembrane will be having a grayish color. Throat will be feeling raw and sore because of all the ulceration. Look raw in sports, especially in public speakers. There will be necrotic destruction of soft parts of palate and fauces because the diphtheria will not be very simple. It is a malignant one, necrotic in nature. Even the neighboring tissues will be affected. There will be intense hyperemia. Swallowing is very difficult. And in nose and all, it doesn't matter much. Yeah, urinary, because we told if there is nephritis, there can be urine. So nephritic syndrome, the amber color or golden color, which indicates the presence of RBC. Uh, then it can be dysuria or albuminous or scanty in nature. Even the suppression of urine can be seen. All the symptoms related to nephritis. Moisture with icy coldness, but however, it is just boric have been put in total. I can say you just remember that ulceration, necrosis, yeah, the dark fluid blood, prostration, and also that downward spread. Given mercurius base and diphtheria, when the membrane is greenish and inclined to spread through the nose, involving a large surface, the cyanide of mercury is needed. Spread through the nose means, as I told, it is going downward. So in case of mercurius cyanide, when it is indicated, the ulceration or the diphtheria, it starts from the nose. So it will be a nasal diphtheria and going towards the laryngeal one. It has exudation more marked than any other form of mercury. Malignant forms rapidly forming and with phagedenic ulceration. The next one is Merc dull, and Merc dulcis is actually for complaints. Put in short in one sentence or two sentences. It is usually for the symptoms similar, where there is affections of the eustachian tube. So another suitable remedy for the same complaints will be calimure. Similar symptoms. Eustachian tube is when affected. So mercurius dulcis is chloride of mercury or calomel. Mercurius chloride, that's the chemical name, HgCl, and trituration is made. In Allen's keynote, what we study is catarrhal affections of the mucous membrane, especially of eye and ear, or specifically of ear we can say. Deafness will be there because it is the ears that is affected, or even the catarrhal affections of nail, throat and pharynx from mercurial amalgam fillings. Like for some teeth fillings, this mercurial amalgam was used for some ulcer purpose if mercury was used for the treatment, and that led to the affections of the mucous membrane, leading to deafness or even the throat, nail, pharynx being affected. Then we can think about Mugdal. So the most important feature will be the catarrhal inflammation affecting mainly the ears, the middle ear, and the medicine, as I told you, it is Calimere. The eustachian tube will be closed. Catarrhal deafness and otorrhea in soric children, deafness of old age. Deafness of old age, I don't know how much it would be working, but I have seen one of my professor will be giving older person, especially when they have this deafness difficulty, he giving Calimere, Calimere 6x. Because in our college, the usual practice was to give one potency remedy. So if it is sulfur 200, only one or maximum of two doses. More than that is usually not given. Then one, this one, biochem. And sometimes it will be plain globule also, okay, plain globule, nothing else. So three remedies are what we actually give to the patient, so patient also feels so happy. So because already plain globule is given, teachers don't support giving this one in my college, okay, BT or the blank tablets. They always say anyway our all the biochem it is acting superficially only. It is actually acting as a remedy which to correct the deficiency. So and the potency remedies we know from the principles it is acting in the vitality or the our dynamic um, energy we could say or the vital force. So the sphere of action of biochem and the potency medicines are in two different manner. So why to make the patient eat some BT? We already know that even the globule given is placebo, so at least give the medicine. So according to the suitability of cases, in case of fever, ferrum force being given, in case of there is joint pain, calcarea force is given, and if there is a nasal discharge, super cold, calimure is given. So according to the cases, our teachers will be selecting one or the more apt uh, biochem so that it acts on the deficiency plane. So one of my sir used to give in case of old people who have some hearing difficulty constantly every time let them eat calimere, but I don't know whether it is actually bringing any much change in them, because whenever these people come it is a part of the physiology also, physiological degeneration is happening. But so I always feel, and for us it will be just 1 month posting in one clinic, then it will be another clinic will be going in rotation. So next time we again come to that clinic will be the next year when we complete the third year, then go to the fourth year, then it's when we again come to the same clinic. So we don't see the patient only for 1 month we see the patient. This one I used to see a sir giving during deafness for old people calimore being prescribed. So in case you also can try, if you have an old patient and you are giving some medicine for the joint complaint, and you feel that the calcium replacement is okay or they are taking enough calcium tablet and you don't have to prescribe any calcarea force or calcarea flu, you can think about giving, if they have some hearing trouble, think about calimure. So deafness and catarrhal affection, we told this. Diarrhea, stool is grass green like chopped eggs, profuse causing soreness of anus, don't bother, no one is going to ask you. And in male sexual system, there will be acute affections of prostate after maltreated stricture. In boric, when it comes, it's almost the similar symptoms associated with that. There can be some liver complaints also. Uh, In Merc has a marked effect. It is the catarrhal structures that is affected of the ear, especially the Eustachian catara and deafness that is most indicated. Diarrhea with soreness of anus, prostatitis, and remittent and bilious attacks. The patient will be pale, flabby, and with intense bloatedness, especially indicated in systems disposed to remittent bilious fever, in peritonitis, and also meningitis with plastic exudation. And now this plastic exudation, actually, when I was reading Boricoli, I saw that term. I had never read because Berkdal we study only from Keynote, not from Boric. So, does any one of you remember for plastic exudation? What was the explanation given by Partha sir? What is this plastic exudation? Does it mean the catarrhal exudation, the thick white one? Any one of you remember?
I can read.
I can't remember. Lenny, do you remember? Yetling? Anyone?
Not exactly, because I always confuse this mercurial duchess and the other two, the cyanatus and the solubilus.
Solvus. That's why I told you even one sentence. Just remember. In case of sinusitis, only remember the throat is affected and then it is going downward. Downward means it will be starting from the nose. Just remember that much only. And then you put by your own mercurius for the common symptoms. That much is enough. And then in dulcis, it is the eustachian tube that is affected, the catarrhal affections. So what I guess is plastic exudation, and because it is catara, it should be thick white. And then a mimic or smile is given like a plastic, it is the white thick one. But I would like you to go back, maybe Professor's notes, maybe somewhere he had given an explanation what is this plastic exudation is. Just to know, even I am very curious, this term plastic exudation. So, then there can be dropsies due to renal or cardiac diseases, especially with jaundice, cirrhosis of liver. But still, I will say you, Magdal, if anyone is going to ask you, it will be just the catarrhal affections they will be asking you, and then you have to just stick on with the eustachian tube and the deafness associated. In ears, otitis media, the middle ear is affected, yeah, because it is the eustachian tube, the middle ear that is affected. Closure of the eustachian tube, ear troubles in scrofulous children. Membrana tympani retracted, thickened, and immovable. And in mouth, there can be halitosis, salivation, so typical feature of mercurius. There can be sore gums, ulcers, also of mercurius. Tongue will be black with constant flow of dark putrid saliva. That is also the feature of mercurius. Mercurius also is having a large quantity of what is that, saliva filled in, and bad smell or halitosis with all the ulcerations, um, which is very offensive in nature. Ulceration of the throat with dysphagia. Then in rectum, scanty bloody mucus, the mercurius one, the constant desire without tenesmus, dysentery, small stools of mucus and blood covered with bile. In a sore and burning in nature, doesn't matter much. Skin will be flabby and ill nourished. Don't bother, leave. Only remember the catarrhal inflammation, especially of the ears, the middle ear, eustachian tube, the deafness associated. That alone will do. No need to remember all the stupid things. Then millefolium. Millefolium, it is a hemorrhagic remedy. So in case of melilotus and millefolium is another two remedies that I always get confused with. So melilotus, like a lotus, the person will be becoming very congestive in nature, maybe having headache, but once the hemorrhage passes, he will be having amelioration. And in millefolium also, it is the hemorrhage that is characteristic from any orifice. It will be the bright red color blood that is oozing out from the body. So millefolium common name is very important, okay? Can be asked for a MCQ. Yarrow. Yarrow is the name. There are so many other names, Boreal, Yarrow, California, forget about it. The second name, the Yarrow is one. So millefolium, common name, Yarrow, please remember. Belonging to the family Compositae. They are given even specific Asteraceae, but no need, Compositae is enough. Non-hazards, extended use of this plant either medicinally or in the diet can cause allergic skin rashes or photosensitivity in some people. It is a possible sedative and diuretic effect from ingesting larger amount. Habitat usually seen in meadow, pasture, lawn, etc. but very poor on the soils. Homeopathic preparation, tincture of whole fresh plant is taken. So from the picture itself, you can see everywhere there is hemorrhage that is happening. An invaluable remedy for various type of hemorrhages, but the nature of the blood is what you have to remember. It will be blood bright red in nature, profuse in nature.
This is very good for hemorrhage.
Yes.
Millefolium.
Yes. Very nice remedy for millefolium for hemorrhage. Any type of hemorrhage, even if it is a menorrhagia, it is a very nice remedy. In case of incarcerated hernia, smallpox, leave that off. After operations for calculi or any operation when there is a hemorrhage and the characteristic of blood is blood bright red, we can think about it. And then the causation, the bad effects from fall from a height, overlifting. Please don't forget that. There is continuous high temperature and hemoptysis. Hemoptysis means during cough, vomiting of the blood. But this one, the continuous high temperature, actually when you all came into online, I was still taking time referring something. That was this point. Because there is continuous high temperature, it is the point that is given in boric. But in keynote, it is been given that there will be hemorrhage but no associated fever. Completely contradicting symptoms they have given. So I was referring actually Clark. What is the truth? Because sometimes it may be the boring that boring that is having some mistake, or either it could be with the Allen's keynote. So I was having confusion because millefolium is a drug actually present in Allen's keynote. So I have always studied only from Allen's keynote. When I was reading through it, continuous high temperature I saw, and I took the boric and checked it. It is correct, and I again checked it, double checked with Allen's keynote. There is the characteristic feature is hemorrhage with no fever, and that is how I used to study since the time I started learning millefolium. Hemorrhage with no fever, that is millefolium. And then I took Clark, and Clark hasn't told anything about it, whether it is having fever or not. It has not told anything. So I don't know how you should interpret that. In the paper, you write both will be accepted. And in the clinic, you can use your own intuition to give this medicine. Then for this one, yeah, the symptoms will be in case of head. I will say you to remember only convulsions and epilepsy from suppressed menses. The head seems to be full of blood, so that congestion that leads to convulsions or epilepsy, and that is coming from suppressed menses. That will be the only sentence I ask you to remember. Then from nose there is epistaxis, stool hemorrhage from the bowel or the bleeding hemorrhoids, and then urinary there is hematuria. So everywhere there is blood coming out. Menses, which is early, profuse and protracted or long lasting. Hemorrhage from the uterus, which is bright red fluid. And there is also painful varices during pregnancy. This is important. This I have seen as a specific, uh, the varicose veins during pregnancy, a specific being Millefolium told as a specific. Let me choose something else. In respiratory hemoptysis, especially in phthisis or tuberculosis, cough with bloody expectoration, in suppressed menses or hemorrhoids with violent palpitation. And in Allen's, it is ailment from overlifting or from overexertion or fall. So the wound that is happening and that resulting in hemorrhage, which is painless and without fever. See, this is how Allen say it is without fever, and Boric say continuously high temperature. So both will be accepted whatever you write. Bright red fluid blood in nature from any part, from lung, bronchi, larynx, mouth, nose, stomach, bladder, rectum, uterus, of mechanical origin of wounds. Wounds which bleed profusely, especially after a fall. This one is important. Leukorrhea. Leukorrhea of children from atony. This is something which we won't be remembering easily also, because ultimately we remember only the symptom, that is the hemorrhage. But leukorrhea of children from atony. Even calcarea carb is a medicine, because leukorrhea is not a condition that we are expecting to be seen in in children. So in case if that is being coming up to you, remember the remedy leukorrhea in children, and that due to loss of tonicity of uterus. It is calcarea carb and millefolium. And then cough with hemoptysis is usually seen at aggravation 4 p.m. like lycopodium. There is painless drainage or painless bleeding. This can happen even after labor or abortion, and also it can be used as a preventive in postpartum hemorrhage. This is also important. According to Kent, Millefolium is the most useful remedy in varicose vein, uh, especially capillary, spongy and enlarged. Vein break easily when congested, and varicose vein especially also during pregnancy. Yeah. Varicose veins on the limbs during pregnancy and when painful. That's what Kent is saying it as a remedy. Wounds bleed much easily. Chymosis. There will be local congestion, hemorrhage from anywhere, atony of blood vessels, or they won't be uh, constricting to stop the bleeding. It will be in a relaxed condition that the blood is actively passing out. After an operation and the wound has been properly closed, the skin formed in the edges will still continue to ooze bright red blood, and also millefolium can be given. When a general hemorrhagic condition prevails, especially when these features are often associated with heart troubles. If there has been a history of bleeding, it should be given before a surgical procedure. That's all for today. So we did, I think, 6 remedies. Medurinum, Melilotus, Mephitis, Merc, Merc, and also Millefolium. So don't forget.